you cannot have academic success without students also being emotionally well.
It starts with a conversation. Dr. Bobby Cruz is the State Education Director for the Public School System's Mental Health Department.
The practice has been, we just don't talk about it because we're mamala, we're ashamed.
The department's federally funded program known as Project Taligi is hoping to change that for the 9,000 students on Saipan, Tinian, and Rhoda. After a pandemic and typhoons Dolphin, Sudalor, Yutu, and Mangkut, students were ripped away from the classroom and their campuses were hit hard. The mental toll is a growing concern. Josiah Kayanka manages the project's data.
Overall, we've seen a increase in anxiety within our students and even within our community members. Overall, there's just been an increase in anxiety. But one of the things that we do within this is we are constantly looking at the ebbs and the flows of what our data is showing us, because that is really where the important piece of kind of knowing where our students' needs are.
One of those data points is the CDC's Youth Risk Behavior Survey, where students respond to a range of health-related questions, including mental health. Over 1,400 middle school students and 2,200 high school students responded to the 2021 survey. 22% of middle schoolers and 31% of high schoolers say their mental health was most of the time or always not good. 43% of middle school students and 53% of those in high school say their parent or other adult in their home lost their job during the pandemic. The damage left by recent typhoons stresses the issue. Walter Mendez works with schools on Saipan for the project.
The schools are seeing, like Hopwood for example, they're seeing lots of concerns with students who live in similar homes. Their homes are still like half broken, half repaired, or not repaired at all. And so we're still living with that fact. And the truth is that these kids are coming to schools with that kind of stress happening. They're reminded by the stress that they see when they look at the school buildings, and stuff like that affects their ability to learn, their ability to cope with the things that are happening in their daily lives.
That's where the school's multi-tiered systems of support comes in. Recently, the public school system reached national standards of having one counselor per 250 students on campus. At Tier 1, they focus on outreach and creating a safe environment for all students. Tier 2 is targeted, where staff identifies students at risk and places them in group counseling or with a therapist. Tier 3 is intensive, where support is provided to the students' needs and referred to community mental health partners. Another tool the project uses is a new universal screener, which students take at the start of every school year, which also includes questions related to mental health. They've used it for 3 years now.
We saw that in year 1, parents were asking for things like support with a laptop or technology things. And that just really isn't the essence of what that tool is meant for. Whereas now, they're talking the language of mental health. They're saying words like, my child is maybe depressed. My child is dealing with anxiety. My child is anxious about going back to school.
That screener has led to hundreds of check-ins by mental health staff during the school year.
It's just nice to see how we're changing how we look at how do we ask for help, because culturally that's not something that we are used to doing. We have close-knit network and we don't really extend further out.
Thomas Manglona, KUAM News, Saipan.